Okay, let's dive right into this. Are you just completely frustrated with buying endless skincare products, only to end up with angry breakouts and stubborn dark spots anyway? I mean, you spend the time, you spend the money, and somehow your skin still isn't where you want it to be. Well, welcome to today's Explainer, where we're going to look at the actual, undeniable science of your skin to figure out what really works.
I want to start by just acknowledging a really common frustration. So many of us feel like we're doing everything exactly right. You wash your face, you carefully apply all the serums, you use the spot treatments, but your skin is still tight, it's sensitive, and it's actively breaking out. It is incredibly discouraging. But as we'll see today, the issue often isn't that you aren't doing enough. It's actually that you might be doing a little too much and inadvertently wrecking your skin's natural defenses.
Because here's the really wild thing. The secret to fixing acne and those lingering dark spots isn't some harsh scrub or a magical 10-step routine. The true secret is actually understanding and protecting your skin barrier. When dermatologists look at clinical guidelines for treating acne, they always emphasize one thing: healthy skin is calm skin. If your face is inflamed, irritated, and stripped of its natural defenses, literally no amount of expensive acne medication is going to give you that clear complexion you're chasing.
So let's define exactly what this skin barrier actually is. Medically, it's called the stratum corneum. It's the very top layer of your epidermis. Now, I want you to picture it literally like a brick wall. In this analogy, your skin cells are the bricks, and your essential lipids and proteins, they're the mortar holding everything firmly together. When this wall is intact, it does an absolutely amazing job. It locks the good stuff in, like water and natural hydration, and it keeps the bad stuff out, like irritants, pollutants, and acne-causing bacteria.
But what happens when that brick wall starts to crumble? Well, if you're over-exfoliating, using super harsh cleansers, or just washing your face way too often, you strip away that essential lipid mortar. This causes a phenomenon known as transepidermal water loss, or TEW. Basically, your skin loses its ability to hold on to moisture. That's when you get those awful symptoms: persistent tightness, flaking, burning when you put on a lotion that used to be totally fine, and yes, unexpected breakouts. Because without that wall, your skin is completely vulnerable to bacteria.
Okay, let's bust a massive myth right out of the gate. Acne does not mean your skin is dirty. I know, we all just want to aggressively scrub the acne away and be done with it. But scrubbing your skin squeaky clean? That's just going to irritate your barrier and cause your acne to flare up even worse. The scientific fact is that acne develops when your pores become clogged from the inside. It's a mix of excess sebum, your natural oil, dead skin cells, and bacteria. You literally cannot scrub that away.
And that brings us to myth number 2, which is a big one: skipping moisturizer because you already have oily skin. I mean, it sounds totally logical, right? Why on earth would you add moisture to oil? But it actually backfires completely. When you skip moisturizer, your skin gets dehydrated, and in a total panic, trying to compensate for the lack of moisture and fix that barrier, your skin pumps out even more oil. That extra oil clogs your pores further, leading directly to, you guessed it, more breakouts. Moisturizing with a lightweight, non-comedogenic lotion is absolutely non-negotiable.
Finally, we have to talk about popping. Look, we all know the temptation. You see a blemish, and you just want it gone right that second. But you absolutely must resist the urge to squeeze. Sure, you might get a little bit of it out, but the pressure actually pushes pus, dead skin cells, and bacteria way deeper into your skin. This massively increases inflammation, drags out the healing time, and practically guarantees you're going to be stuck with a lingering, stubborn dark spot or scar. So if we aren't scrubbing and we aren't picking, what actually works medically? Well, dermatologists agree that topical therapies are the absolute cornerstone of acne management. You really don't need complicated DIY hacks. You need targeted, scientifically proven ingredients that go after the root causes: the clogged pores, the bacteria, and the inflammation, all while totally respecting that protective brick wall we talked about earlier.
Forget those harsh multi-step routines. The science points to a few proven heavy hitters. Benzoyl peroxide is fantastic because it actively kills acne-causing bacteria while helping shed dead cells. Then you have topical retinoids, which are vitamin A derivatives, and these are pretty much the gold standard for unclogging pores and stopping new blemishes before they start. Salicylic acid is a great gentle exfoliator. And just as importantly, we have ceramides. Remember the mortar in our brick wall? Ceramides help restore that natural barrier, keeping the good moisture in, while all those active ingredients do their heavy lifting.
Now, all that trauma to your skin barrier leads directly to our next huge concern: those frustrating dark spots left behind after a pimple finally heals. Clinically, we call this post-inflammatory hyperpigmentation, or PIH. When your skin experiences the trauma and inflammation of a breakout, especially if you couldn't resist picking at it, it reacts by overproducing melanin, which is just your skin's natural pigment. The pimple itself is long gone, but that annoying dark shadow remains.
So how do we fade these marks safely? You want to look for specific ingredients. Azelaic acid is an amazing topical agent because it literally lightens that dyspigmentation, and it's generally safe for sensitive skin. Retinol, or things like licorice extract, can also really help resurface the skin and even out your tone. But honestly, the absolute most critical step is daily, broad-spectrum sunscreen. UV rays will literally cause those dark spots to produce even more melanin, locking them in and making them way harder to fade. You have got to protect your skin from the sun. And, again, do not pick your blemishes.
Okay, let's pull all this incredible science together into a super simple, actionable daily routine. Step 1. Wash your face with a gentle, non-drying cleanser twice a day, and maybe right after a really heavy sweat. Step 2. Apply your acne treatment. And here's a massive pro tip from dermatologists. Apply a thin, even layer over your entire acne-prone area, not just right on the active spots. This actually prevents new blemishes from forming. Step 3. A lightweight, non-comedogenic moisturizer to protect your barrier. And Step 4. During the day, finish with that broad-spectrum sunscreen.
Now, a quick reality check. The American Academy of Dermatology constantly reminds us that you have to give an acne treatment time to work. Usually that means about 6 to 8 weeks. Remember, your skin is a living organ, and it takes roughly 28 days for it to completely renew itself. Because of that natural cycle, skincare is totally a marathon, not a sprint. If you're switching up your products every single week because you're impatient, you're just going to irritate your face, damage that barrier, and trigger even more breakouts. Be consistent and just be patient.
To wrap things up, please remember, this video is for educational purposes only and is not a substitute for professional medical advice. If you have persistent or severe skin concerns, consult a qualified dermatologist. They can safely provide prescription-strength treatments if you need them. Basically, treat your skin gently and it will thank you. But it really does make you wonder, if we've been getting acne care this completely wrong for so long, what other everyday skincare habits do we need to completely unlearn? Something to think about. Until next time, keep taking care of that barrier.